Madam Chair, would you like to move your bill?
Yes, Mr. Chair, I would like to move House File 1225 to be laid over for possible inclusion in the Long-Term Care Division report.
Thank you. And I believe you have an author's amendment?
I do. We have a DE1. I'd like to move the DE1 amendment to House File 1225.
Discussion? Okay. So the chair moves House File, the DE1 amendment. All in favor, say aye.
Aye. Aye.
Any opposed to the author's amendment? Okay, author's amendment is adopted. Madam Chair, please proceed with presenting your bill.
Okay, thank you, Mr. Chair and members. House File 1225 deals with personal care attendant services, or PCA services, and we all know that the PCA services are one of the most cost-effective ways to provide individuals with disabilities and older adults the opportunity to live safely and with dignity in their homes and with their families. We also know that while working as a PCA, it can be very rewarding, but it's also incredibly difficult work. PCAs help individuals with some of the most basic necessities of life, and in many instances, they also assist with very intimate activities. These are vital services needed to keep individuals safe in their homes and out of higher cost residential facilities, and to support these individuals to live their lives with dignity. However, unlike many other services provided in our market economy, for the vast majority of the nearly 43,000 individuals receiving PCA services today, the state of Minnesota sets the reimbursement rate and thus in effect wages for these services. Therefore, unlike most other industries facing a workforce shortage, the PCA services community is not able to simply adjust their own services and rates in response to economic trends. The average PCA makes just about $11.78 an hour. That low wage, especially when combined with the difficulty of the work, makes it hard for PCA agencies and individuals receiving care to recruit and retain workers. This is not a new problem, and House File 1225 is not the only piece of legislation you're likely to hear this session that attempts to address this vital issue. However, this legislation is different in its approach. In past years, we have heard proposals seeking rate increases for PCA services. That is because PCA services are reimbursed at a historical rate established years ago that has subsequently ticked up or down each biennium based on the finances of the state. In the last decade, the rate has increased $1.16 an hour, an average of less than 12 cents a year. House File 1225 would fundamentally change the way the state pays for PCA services by using workforce and Minnesota market data to recognize the actual costs of providing these services and provide the legislature a framework to, over time, build those costs into the system. It would also allow the data to be reevaluated every 2 years so that the PCA program is responsive to the needs of Minnesota, and would maximize our limited resources and help as many people as possible live safely and work as independently as possible in their communities. This bill is not about a simple rate increase. It's about establishing a long overdue, data-driven, evidence-informed rate-setting system for this most critical program that supports 43,000 Minnesotans with disabilities and older adults to live a quality life with safety and dignity. Mr. Chair, I have a testifier here who's ready to testify.
Thank you. Welcome to the committee. Please state your name for the record and proceed with your testimony.
Thank you, Mr. Chair, and I do have my testimony available, which I believe the page might have to hand out for you too. Good afternoon, Mr. Chair, members of the committee. My name is Jeff Bangsberg. I'm the board chair of the Metropolitan Center for Independent Living. As some of you may recall, I have testified for the last 2 years regarding the critical shortage of the personal care assistants for people with disabilities, particularly those with high needs. This shortage has gotten worse, not better. Last summer, the state's Olmsted Subcabinet approved the recommendations of its Direct Care Shortage Work Group report. Following these recommendations, our group of consumers, stakeholders, providers, and advocates was created to reform the PCA program in order to keep it from imploding upon itself. With technical assistance from the Department of Human Services, the PCA Reform Coalition put together a proposal to address the workforce crisis to make the program sustainable. This proposed legislation addresses 4 basic essential elements or priorities. First is to establish a framework to pay personal care assistants a fair wage. This framework is based on 2 data-driven assumptions. First, as Representative Schultz had articulated, is to utilize the standard occupational classification codes published by the Bureau of Labor Statistics to develop a wage component. Second, it's to incorporate a competitive workforce factor, comparing PCA services with other jobs in the economy based on education, training, and experience. PCA rates are currently determined only by the legislature, not the market, resulting in PCA wages falling far behind. This new framework will establish an objective system for determining PCA rates. Second, to build on the existing enhanced rate for PCAs who provide care to people who are most severely disabled and therefore find it more difficult to find and retain staff. Third is to strengthen the provider community by supporting both the personal care choice and the traditional PCA organizations. And finally, to incorporate transparent best practices in order to improve quality and ensure integrity in the PCA program. To be clear, the PCA program is not part of the disability waiver rate system for people with disabilities, so it is not aided by those reforms. Our legislation is built on the principle that PCA should be paid the same as those in DWRS, with forecasted increases to keep up with the economy. Being a PCA is a rewarding but very difficult job. PCA wages have to keep up with the market economy, or the PCA program that started 40 years ago will implode. Failing to act will force thousands of clients who rely on this very critical service to move into more costly institutional settings like a nursing home. Thank you.
Thank you, Mr. Bangsberg. Madam Chair, you have
I
more
think we have
testifiers?
2 more testifiers.
Thank
Stay
you.
there, Jeff.
Welcome to the committee. Please state your name for the record and proceed.
Hi, my name is Dina Belial, and thank you, Mr. Chair and committee members. I am the president of the Minnesota First Provider Alliance, a statewide association of PCA provider agencies with 100+ members. I'm also a member of the PCA Reform Coalition, and I run a small PCA agency from my office in Lakeland, Minnesota. But most importantly, I am the mother to my son, Anthony. Anthony is 38 years old and severely disabled. He receives 12.5 hours of PCA services per day. He has very high needs and requires complex care, and he's nonverbal. My son functions best with a consistent routine. He gets very anxious if we deviate from his routine. Having a new PCA come into our home can be difficult because he is nonverbal. It takes a long time for someone to learn how he communicates. The way he gives you a look or moves his fingers all indicate what he is trying to tell us. As his mother, I know the look and the movement, and I know just what he wants. It takes time for someone new to learn that. It also takes time to train a PCA on how to do his complex care, which include his bowel program, seizures, and swallowing disorders. So you can understand the struggles we face and the importance of having PCAs that are able to stay with us. A low turnover of staff is critical for many reasons. Familiarity with the client creates the ability to detect a potential health concern early, and it is an important component in preventing a traumatic and costly visit to the ER or ICU. My agency provides services to individuals who are enrolled both in the PCA Choice and the traditional PCA program. Even with the flexibility that having both programs provide, the ongoing staffing crisis means I have had to tell families that I'm unable to find PCAs to work for them. One of these families, whose parents are their caregivers, is facing the very real possibility of having to be moved to a resident home. One of the parents has been diagnosed with stage 4 cancer, and we are unable to find a PCA to work. They are not only, this is not only terribly sad but difficult for the other parent, but is extremely costly alternative to having a PCA come into their home. As a provider who is also a mother, I can tell you there is nothing more frustrating than having to tell clients that we cannot help them. I believe House File 1225 would enable us to address the challenges of those already caring for the most vulnerable and assist PCA providers to reach other potential workers who have never before considered working as a PCA because of the low wages and lack of benefits. PCAs need to earn a livable wage. They need to be able to pay their rent and mortgage and put food on the table. They should also be able to save for their own unexpected emergencies and for their future. They should be able to address their own medical issues that could prevent them from working. We must acknowledge personal care assistance as a necessary and valued career by creating a regular, increasing, viable, livable wage and benefit potential for this type of work. The Minnesota First Provider Alliance and the PCA Reform Coalition have worked for months now on a variety of proposals and reforms intended to bring stability and sustainability to the PCA program. We are all desperately working together to find solutions to the workforce shortage and to establish best practice and higher integrity standards in our industry. But we need your help now. We can't afford to wait any longer. Clients' health and safety are at risk. House File 1225 is an important step in addressing the workforce shortage in our industry and ensuring that thousands of families like mine throughout the state can care for their loved one. Thank you so much for your support and consideration today.
Thank you, Ms. Belial. I believe Matthew Bergeron is the next testifier on our list. Please state your name for the record and proceed.
Thank you, Mr. Chair. My name is Matthew Bergeron. I'm an attorney with Larkin Hoffman, and I represent the Minnesota First Provider Alliance. I really can't add anything as to the merits or the needs beyond the testifiers you've heard, but because it is a rather complicated proposal, I'm here to help answer questions, should members have any about the details.
Okay, thank you. Is there further testimony? Others who would like to testify? Yes, may come forward. Welcome. Please
Thank you,
state your
members
name.
of the committee. Chair Schultz, my name is Mark Hughes, former member of the Minnesota State Council on Disabilities. As you can see today, this is a very serious and current issue in the disability community. Now, I have a suggestion. For years, we've heard that they're not paying enough for the PCAs. And I was wondering if we can't, when we're training the PCAs, count it as education. And their years of service times the education should be put on a pay scale degree. And I think that would work. And I also wonder if, when the governors are talking about a surplus, when Governor Dayton left office, there was a surplus. When Governor Walz entered office, there was a surplus. These are vulnerable adults that we must take care of immediately. And I can't tell you the magnitude and how serious this current problem is. And I hope this never happens to you or any of your family who might use a PCA service. So I hope you'll vote yes on affording these people great independence, good health care, and successful employment or retirement, whatever the case may be. Thank you.
Thank you for your testimony. Are there others today? I can't tell if someone is coming down to the microphone as well. Okay. Please state your name for the record and proceed.
Mr. Chair, my name is Dupree Edwards. I I'm actually with Partners in Policy Making, but I want to try to say for PCAs and direct support staff to give them a living wage, and it affects the staff turnover too, for hiring people and stuff like that. And it's just shortage staff everywhere. You know, it's just hard because a lot of people are not going to work for $12 an hour, you know, unless they really care about the job, they're really passionate about the job and stuff like that. So I really feel like we should take this subject very seriously. Last year, there was a 7% cut last summer in this type of situation. And they really need because they're talented, they're valued, they support us, they deserve to have a livable wage, like the other testifiers said, to put food on the table, to take care of their families, you know, and everybody with disabilities, you know, really appreciate what the PCAs and the direct support staff does. And I really wish you guys could take this in consideration and really help, you know, our support, because they support us. They come in here and help us with every need that we can, and they do the best that they could do. And I really feel like we need that. So, yeah.
Thank you very much. Are there others who want to testify today? Seeing none, discussion, questions for the author and testifiers? Representative Cleaborn?
Thank you, Mr. Chair. I would just like to say to Chair Schultz, thank you for bringing this bill forward. In our community of Plymouth, we have a great deal of need for PCAs who are paid a wage where they can also support their families. But this is a matter of life and death, and the shortage of PCAs in my own community is huge. And so anything that we can do to alleviate this struggle for our families is critical. So it's not really a question, it's just a thank you for raising this issue, for bringing this bill forward so that we can serve the families who need help and who are actually trying to do their very best to care for their families. Thank you.
Thank you, Representative Cleaborn. Representative Mason?
Thank you, Mr. Chair. I think we all know that this industry has been in crisis for a number of years, and I truly appreciate you bringing the bill forward. I guess the only reservation I have is it doesn't start till 2020, and we know it should have started several years ago. Thank you.
Representative Keel?
Thank you, Mr. Chair, and Representative Schultz. I've carried this bill in the past and know very well how important we care for, provide PCAs. Mr. Bangsberg, good to see you again. And, you know, this is so difficult because it isn't just about paying people. It is really hard to even find people. Members, I have a business that I've known the young lady for a long time. She owns a business, and she often gives her PCA away. Jeff knows her very well. PCA away so that her clients can have somebody to care for them, and she goes without. And she seems to manage okay, but she does have some family around that can stop in and help her. But as we know, this is very costly, and making sure we have stability is really important. So I'm wondering, we talked about there is a difference between DWRS and PCA service. Maybe either Representative Schultz or Mr. Bergeron, you want to explain the differences in those two things?
Chair Schultz? Or
Maybe the short version, sorry.
So, sure, Representative Teal, Mr. Chair. So there's a rate formula system in the DWRS, in the waiver system. Although someone with similar training could be paid both in the waiver DWRS system and in the PCA system. So what this bill is trying to do is make it more consistent in how we establish a rate formula for the PCA system that mimics very similar to what we've been doing in the waiver rate system. So there's more consistency. So someone, a PCA currently is paid a lot less than someone that's getting paid through the waiver rate system. So here we're trying to really level that pay, wages, and make it more consistent in how we create a formula to pay for these services that obviously are desperately needed in everyone's district community and have been underpaid and really undervalued because they're not paid, there's significant turnover. And so the state has to address this as fast as possible. And you do have a fiscal note in your packet on what this will cost to increase and change just from paying a wage based on the amount of money the state has to paying a wage that reflects the competitive workforce in the state of Minnesota, and then requiring reporting like we do in the waiver rate system of actual wages paid. So we have real data going forward into the future so we can base wages on that real data. And then Mr. Berg can pick, if he wants to explain the fiscal note or follow up with something I missed, or Mr. Bergeron here.
Mr. Berg?
Mr. Chair, members, I don't know that I have anything to follow up on. Just as Representative Schultz mentioned, you'll see there's a fiscal note that shows costs of about $35.6 million in 2021 and significantly about $115 million in the tails. This fiscal note is pretty much useless as soon as it came out because there are significant technical amendments that still have to be done, but it gives you some idea of the scope of the cost as you go out in later years.
Representative Keel, are you?
Oh, I was going to ask another question about unionization of PCAs.
Go ahead.
Okay. PCAs were unionized in 2013 after the legislature declared them to be state employees. So I'm wondering, how would this base wage increase or index, and the rate methodology be influenced by the PCA negotiations, union negotiations? How would that affect?
You want to answer that?
Mr. Bergeron?
Mr. Chair, Representative Keel. So only a portion of PCAs in the state of Minnesota are subject to the collective bargaining agreement. The rate negotiated as part of that process currently applies across the board. However, the benefits and the wages that are negotiated as part of the CBA process only apply to those members in the collective bargaining unit through the PCA choice program as opposed to the traditional program. The way this statutory framework is designed to work is to work alongside of that so that the data being used in the framework would set a realization of what some of the costs are into the system, and then that would be information, including some built-in changes to compensation, would then be subject to the traditional collective bargaining process that we've seen over the last 2 biennium.
Representative Keel?
Well, I'm trying to mentally think about my own district's, one of their PCA services. They're not unionized, and they have real problems providing any benefits at all because half of their employees work through the, I'm going to even have a hard time with the group, the American Indian group that she works with, because she tries to provide the Red Lake Nation clients with actual PCAs that are part of, and they have their own care benefit system. And so she can't even provide her other employees because it cuts them in half. And there's just some real problems there with even thinking about doing benefits, much less paying them a better rate. So, and she has some concerns about some of the fraud that she has caught and reported and has not been stopped. And what bothers me most about that is that takes away from the people who really need it.
Yeah.
And that is really concerning. But that's just a statement, and I'm interested in where we're going with this. And if we can afford this longer term. I know it's very important for our people, those who need PCAs. It's just really important. And Jeff and I haven't had a chance to talk, but I got my own client at home, so
Mr.
he
Bergeron?
takes care of himself better now, but.
Mr. Bergeron or Chair Schultz, your response?
Thank you, Mr. Chair. And Representative, the way the framework is built to recognize costs, employee benefits and things like that in the system and recognize what it would cost to provide that and build that into the eventual rate. It does not dictate how any of those are spent. There's no mandates that those dollars be attributed to benefits. That just goes to the base rate. That for members of the collective bargaining unit, the collective bargaining governs what benefits are mandated. Outside of that, in the traditional PCA, it's the cost of those benefits are part of the rate calculations, but it's not tying, there are no mandates on how it's distributed by the employers.
Thank you.
Representative Cleaborn?
Thank you, Mr. Chair. When I'm trying to do the comparison in my mind, what we know is that people who are in need of services are in need of services. I think we can all agree on that statement. We also know that people will need to be paid to care for the people who are in need of services. What I'm hearing that this bill does, and we will either pay for their care in a nursing facility, or we will pay for their care in a nursing home. So if we pass this restructured system, it would allow us to pay for their care under this structure while they remain at home. So when I'm evaluating this, I want to make sure I have it right in my mind. So if we take the individual and we move them to the nursing home, the costs will greatly exceed the $114 million that we're seeing in the tails. Is that correct?
Chair Schultz?
Thank you, Mr. Chair and Representative Cleaborn. Yes, we're going to save the state money in the long run. The longer individuals with disabilities can stay as independent as possible in their own home. So in the waiver system, which is not the system we're talking about here, but that is specifically set up to avoid institutional care in a nursing home. So that's why you get a waiver to use that money, not for a nursing home care, but to stay within a home for those services. So that's a waiver from using those Medicaid dollars in a nursing home. In this model, PCAs, it's to make sure that they're as independent as possible and they're getting services they need.
Mr. Chair? Yeah.
Representative Cleaborn?
So I just want to make sure that, for the record, we are saying this is truly, while it is a huge dollar amount, it is actually a savings in addition to allowing people to live independently in their own home with the dignity that comes with that as well. Is that correct?
Chair Schultz?
Yes, I think that's a good summary of that. It could be potentially cost saving if we can avoid the institutional care. Correct.
Thank you, Mr. Chair.
Representative Grunhagen?
Oh, thank you, Mr. Chair. Yeah, thanks for bringing this forward. My sister used the PCA, and several of my customers also do. So I know it's at a critical stage in most parts of the state. But I was just wondering on the fiscal note, I was taking a look at that. Why does it jump so from fiscal 2022 to 2023? Are we assuming there'll be more PCAs, or is it just the additional pay, the increase in pay? Or maybe Mr. Berg could address that.
Mr. Berg?
Mr. Chair, Representative Grunhagen, either I or Representative Schultz kind of outlined it at the beginning. It both provides a methodology and a competitive workforce factor to boost wages based on actual reported wage data, and it then inflates it in the future. That will happen. So you start out with a new cost to go to the new system, and then you are looking at actual cost data based on the wages of people in the industry and adjusting upwards based on what's being paid.
Representative Grunhagen?
Oh, thank you, Mr. Chair. So, Mr. Berg, so you're assuming that increase with the number of PCAs we have right now, correct? Or is that?
Mr. Chair, Representative Gruenhagen, no, I mean, in any situation, and I haven't had a chance to go through a lot of detail in this fiscal
Okay.
note, it just came out, but in any situation on forecasted programs, the department takes a look at what will the effect on utilization be from the changes. So I can't tell you without talking to them or reading this more, but there's certainly a utilization change as well as changes to the reimbursement. There are multiple factors in there.
Mr. Chair,
Representative Schultz.
thank you. Mr. Chair, Representative Gruenhagen, if you look at page 6 of the fiscal note, you can see that the rate calculation, the PCA rates are expected to increase by those percentages in that first table. In 2020, 3.2%, in 2022, 9.5%. That's because both wages are going to be going up because of that competitive workforce factor, which also increases over time.
Representative Gruenhagen.
Oh, thank you, Chair Schultz, for that information. So do we need a federal waiver on this?
Chair Schultz.
Thank you, Mr. Chair, Representative Gruenhagen. I think we do need federal approval, but I think, do you know that, Matt?
Mr. Chair, Representative Gruenhagen, the majority of the bill would just require a state plan amendment. There is a piece as it relates to the elderly waiver program that would require a waiver amendment, is my understanding in conversations with DHS. So it's federal approval, but not a
Waiver.
a particularly cumbersome one.
Okay.
Representative.
Oh, thank you, Mr. Chair. Yeah, so does this stand a better chance than that 7% that we tried to get across?
Mr. Berg.
Mr. Chair, Representative Gruenhagen, this is, like, as we mentioned before, this is an entirely different population, but it's also structured in a different way, having lived through that issue to hopefully, and we're pretty confident not to be in that same problem as far as federal approval.
Okay, thank you.
Thank you. Further discussion? Seeing none. Chair Schultz, will you renew your motion?
I renew my motion to have this laid over as part of the division report. And I just want to thank members for hearing the bill and for supporting it.
Thank you. Chair lays the bill over for possible inclusion in the omnibus.